Hi, Tina Ketchie Stearns here. And last week we talked about the 4 levels of hospice care. This week I want to talk about, I guess there's 4 levels, 3 really, but 4 levels of long-term care or senior care. When the loved one can no longer live in the home with family members or by themselves, it's time to get a little more help. So these are really confusing to a lot of families, and so hopefully this is going to be helpful. The first level is pretty much called independent living. That's basically like an apartment. They cook their own meals, they take their own medications. There's usually a dining area that they can take advantage of if they like, but they can fix their own meals in their home, take their own medications, come and go as they please. That's independent living. The next level is called assisted living, and many assisted living communities also have memory care units as well, a locked secured memory care unit. So assisted living, there's a thing called activities of daily living, ADLs, and there's 5 of them. Eating, and when I say that, what I mean is some people might need their food cut up for them, or they actually need the resident aides to feed them. So eating, bathing, dressing, toileting, and ambulating, getting from point A to point B. So everybody in assisted living, and if there's a memory care unit as well, everybody gets help with 2 things, food and medication, because they're not allowed to have a cooking element in the room, so they can't fix their own meals like they could in independent living, and they're not allowed to have medication in the room. So everybody gets help with food and medications. And then beyond that, there are those activities of daily living, eating, bathing, dressing, toileting, and ambulating. So that's what assisted living and memory care does. And the big difference between assisted living and memory care is the staff to resident ratios. Now they're probably different from state to state, but where I am in North Carolina, it's 1 staff person for every 16 residents in assisted living and 1 staff person for every 6 residents in memory care. Or at least that's the ratio with the communities that I work with, adhere to. Because people in memory care typically need a lot more hands-on care. So the staff to resident ratio is much lower. And then let me just say real quickly, 2 main reasons somebody needs a locked memory care unit. One, they're exit seeking. So they're actively trying to leave the building. You'll find them in the middle of the street. So that's not safe. And then behaviors. If there's just difficult behaviors, that's a little more than would be appropriate in assisted living. Those are the 2 main reasons somebody would need a locked memory care unit. If your loved one has some mild dementia or cognitive impairment, even Alzheimer's, but they're not exit seeking and they do not have difficult behaviors, they may do fine in assisted living. They may not have to have a locked memory care unit. So we've done independent living, assisted living and memory care, and then the last level is skilled nursing. Skilled nursing facilities. You'll hear people call them SNFs, SNF, for skilled nursing facility. So the key word there is nursing. In skilled nursing facilities, they have to have an RN on site 24/7. So people in skilled nursing typically have something going on that requires a nurse involvement, maybe wound care or catheters or IVs or trachs, or they can't bear weight at all, so maybe 2-3 person assist. So that's skilled nursing. Okay, independent living, assisted living and memory care pretty much helps with the activities of daily living, and then skilled nursing where you need a nurse involvement. All righty, I hope that's helpful. If you have any questions, just reach out to me, Tina@itsabouthowyoulive.com. Thanks. Talk to you next week. Bye.